Hi, welcome to Community Conversations. I'd like to introduce Dr. Sara Guzick, who is going to be our speaker this evening. She's talking about human papillomavirus, and commonly known as HPV in the media. And so there's lots of myths and facts, so we'll look forward to an informative conversation. Thank you for coming.
Perfect, thank you. So we'll get started. So let's go through some of the myths that are out there about HPV. Myth number 1, only women can get HPV. Number 2, people with HPV show symptoms. Number 3, you must have sexual intercourse to get HPV. Number 4, there are treatments for HPV. Number 5, HPV interferes with pregnancy. Number 6, the HPV vaccine protects you for life. Number 7, HPV vaccines are all the same. Number 8, the HPV vaccine increases sexual activity. Number 9, the HPV vaccine may cause dangerous medical problems. And number 10, you got the HPV vaccine, so you can now skip your Pap test. So throughout this lecture, we're going to debunk these myths by providing the facts about HPV, and then we'll go through these again at the end and show how each of these are wrong. So what is HPV? HPV, also known as the human papillomavirus, is a long known cause of warts. In addition, this is found in certain types of cancer. There are over 100 types identified. Most types are benign, but approximately 15 to 20 can cause cancers. There are approximately 60 cutaneous types, and so these are the warts that you see involving the hands and the feet. And then approximately 40 mucosal types. These are the ones that are going to infect the genital areas involving the vulva, the vagina, cervix, rectum, anus, penis, or scrotum. Certain types of HPV in the genitals may cause genital warts, which are technically considered low-risk types. Cell changes, which may lead to cervical and other types of cancers, are referred to as the high-risk types. So HPV, again, can be broken down into low-risk and high-risk strains. So we know that certain low-risk strains are going to be associated with things like benign cervical changes or genital warts, and these are commonly going to be HPV 6 and 11. The high-risk strains are going to be the ones associated with precancerous cervical changes, cervical cancer, anal and other cancers, and oropharyngeal cancers. And the most common ones that we see with this are HPV 16 and 18. These numbers will come into more significance when we go through the HPV vaccines. So a little bit more about the human papillomavirus. The incubation time is about 3 to 4 months from infection. The infection range normally lasts approximately 1 month to 2 years. HPV that does not go away can stay undetected for years. HPV that does not resolve can progress to precancerous abnormalities or cancer. This makes it difficult to know when did people become infected, how long have they been infected, and who passed the infection to whom, which are all very common questions that we get in the office. So how many people are truly affected by this virus? Genital HPV infections are very common among sexually active individuals. Greater than 90% of sexually active men and women will acquire this infection at some point in their lives. Approximately 80% of women have HPV by age 50, and approximately 50% of college students are infected with the HPV virus. At any time, there are about 20 million people that have a genital HPV infection. So this is a very common infection. In fact, it's the most common sexually transmitted infection in the United States. An estimated 79 million females aged 14 to 59 years are infected with HPV. There's a 74% of new infections occur among young individuals aged 15 to 24. Each year, we see 14.1 million new infections associated with this. And the estimated cost of this ranges around $1.7 billion spent to treat these conditions associated with genital HPV. So what are some risk factors for HPV? Sexual behavior, frequency of sexual activity, early onset of sexual activity, number of lifetime partners, male partners, number of lifetime partners, age, ethnicity, smoking, immunosuppression, and inconsistent condom use. So what are the symptoms associated with HPV? And I've really broken this down into the low-risk HPV and high-risk HPV. The most frustrating part about this virus is that sometimes there are no symptoms at all. In terms of the low-risk HPV infections, this may include single or multiple fleshy growths around the penis, scrotum, groin, vulva, vagina, anus, or urethra. These can also be associated with itching, bleeding, burning, and pain. The symptoms may recur from time to time. In terms of the high-risk HPV infections, these infections typically do not cause any symptoms. Most women feel fine even when they have cell changes in their cervix that can lead to cancer. Regular cervical screening can detect these changes though, and we'll go into that a little further. And then treatment, if needed, is simple and effective. So how is HPV spread? Any kind of sexual activity involving skin-to-skin genital contact with an infected person, vaginal, anal, or oral sex, and other skin-to-skin contact. The key point here is that intercourse is not necessary to acquire this infection. People with HPV, again, may not show any signs or symptoms, so they can pass this virus on without knowing it. So can HPV cause health problems? So again, benign disease that HPV can cause would really primarily be the genital warts. Premalignant disease in terms of cervical dysplasia or abnormalities in the cervix. And then malignant disease, which falls then into cervical cancer, vaginal cancer, vulvar cancer, penile cancer, and oropharyngeal cancer, so potentially involving the mouth, tongue, tonsils, and the back of the throat. So this diagram is a little busy, but this breaks down the HPV types and then the relationship to the cancer that it causes. So the colors that you really want to focus in on are the dark blue and the light blue. So these are going to account for the majority of those cancers. And the two ones that I really draw attention to is the very top one, and I apologize, I don't have a light to shine. The first line is going to be cervical cancer. So as you can see, the average number of cases per year is about 9,500. 9,500 of these cases are caused by either HPV type 16, 18, or 31, 33, 45, 52, 58. Why this is important in my world is the HPV vaccine, or the Gardasil 9 vaccine, covers against these strains. I then draw attention to the bottom of the slide, which goes into causes of cancer in males. And the bottom one really shows the correlation between the HPV virus and oropharyngeal cancer. And again, especially that type 16 and 18 account for a large portion of oropharyngeal cancers diagnosed each year. So this diagram breaks down HPV-related cancers by gender. So as you can see, in women, which are going to be on the left, the majority of HPV-associated cancers are going to involve the cervix. And for men, the majority of them are going to involve the oropharynx. And again, as we get more into the vaccine, I think it becomes clear then why we really need to promote the HPV vaccine as a cancer-preventing vaccine. So a little on oropharyngeal HPV and cancer. So the diagram on my right goes through oropharyngeal cancers, not only overall rates, but then the relationship with HPV. And so the line in red shows that since the late 80s to the mid 2000s, we have seen the rates of HPV-associated oropharyngeal cancer go up significantly. So again, as a gynecologist, this is not something I deal with very often, but I did want to touch on this. So there are approximately 11,000 cases annually of oropharyngeal HPV associated cancer. 7,000 of these are in men. It's estimated that by 2020, this will be more common than cervical cancer. 60 to 80% are HPV positive, and of those, nearly all are type 16 positive. So back into my realm, which more is going to deal with cervical cancer and the relationship to HPV. This diagram shows kind of the life cycle of what HPV can do to the cervix. So women can acquire this infection. They can, at the time, clear the infection. So they may have it, and then within a 2-year period, their bodies may clear the infection. Now, if their body does not clear the infection, we can see the HPV-infected cervix progress. And that is where the HPV virus is going to kind of take over at the level of the cervix. So we can see this progress into precancerous lesions. The HPV cervix we're going to detect with pap smears. Now, precancerous and cancerous changes we're going to be able to detect with biopsies. So certainly we do recommend regular pap smears, but then with abnormalities it is important to have appropriate follow-up and biopsies as indicated. Even with precancerous changes, we can sometimes see regression. But if a precancerous lesion does exist in the cervix, and let's say someone stops going to their gynecologist for 10 to 15 years, they're at risk for this developing into cancer. So how do I know if I have HPV? So important key things for us as clinicians: a history. What is the sexual history, including number of partners, sexual practices, and age of first intercourse? These topics are very sensitive topics and are ones that are sometimes embarrassing to answer, but there is a reason behind us asking these types of questions, especially in terms of risk profile. Is there a history of STDs in patients or sexual partners? And if female, do they have a history of previous abnormal pap smears, and what were the results of those? In terms of physical exam, genital exam, and I also put in their oral exam, especially if people are having symptoms, and pap smears. And then another common thing is the HPV test. What is the HPV test? So this is a test that we use in conjunction with a pap smear. And so this is going to test for high-risk HPV strains. It is approved for routine screening along with the pap test for women 30 years and older. If both tests are negative, I apologize, this is a typo, it can be repeated in 5 years, not 3 years. So when we find that the HPV is negative, it really gives us confidence to be able to space those pap smears out. It is also used after an abnormal pap is obtained for a younger woman greater than 21 years old. And this is used in accordance with our follow-up care. So treatment for HPV. Can I be treated for HPV or health-related problems caused by the HPV or the human papilloma virus? Treatment is really aimed at HPV-related problems. Treatment will not eradicate the virus. Treatment will not reduce infectivity. Treatment options do exist for low-risk HPV and for high-risk HPV. So I'll kind of break down how that works. So again, the primary goal for the treatment of low-risk HPV is removal of symptomatic warts. Therapy may reduce, but probably does not eradicate infectivity. So we may be able to remove these warts, but again, these people can still pass this virus on. It's difficult to determine if treatment reduces transmission. Treatment options include, we can do treatment that is patient applied, and this really falls into a treatment called imiquimod or Aldera, and there is also Podophyllix. This treatment, patients are going to apply to the affected areas at home in the privacy of their own home. It does require compliance, and it is a long treatment span, so it's not necessarily easier than any of the other ones, but some patients do prefer to do this at home. There's also provider-administered treatment, and that's going to be treatment that we do in the office. Common treatment involves chemical agents such as TCA or podophyllin, and cryotherapy or freezing therapy. And then certainly there's also surgical excision, and this can be done in various manners, including laser therapy. This is sometimes used for larger symptomatic warts, depending on their location. Treatment for high-risk HPV. So the treatment for high-risk HPV is really mandated by abnormal pap smears and biopsies of the cervix. So high-grade cervical abnormalities require treatment, and we treat these to prevent the progression to cancer. So treatment options for high-risk HPV, especially once we start to see these precancerous abnormalities in the cervix, are going to be, historically, cryotherapy was used. We don't use this as much anymore. LEAP and conionization are two surgical procedures where we remove a portion of the cervix, in addition, as is a laser treatment, again, involves removing a portion of the diseased cervix. Some patients will opt for no treatment, but in order to do this, it's important to have a follow-up plan and repeat regular testing. The goal with treatment, it's not only diagnostic but therapeutic. So it gives us a larger piece of tissue to look at, but it's also therapeutic in that it removes the diseased portion of the cervix. So how can I avoid HPV and the health problems it can cause? So practicing abstinence, having only one partner who has no other intimate partners, use condoms every time, and get the HPV vaccine to lower your risk of HPV infections related to genital warts and to cervical cancer. So this gives kind of a good segue into the HPV vaccine. So in 2006, the FDA approved two vaccines. The first was a bivalent vaccine called Cervarix. So this vaccine was directed against the HPV type 16 and 18, which was responsible for 70% of cervical cancers and other HPV-associated cancers. And this is where I said earlier that these numbers really come into play when we start looking at the vaccines. We also had the quadrivalent vaccine, which is also known as Gardasil. This contained four types, types 16 and 18, together with HPV 6 and 11, which is responsible for more than 90% of genital warts. So the Gardasil, the original Gardasil, had two high-risk strains and two low-risk strains that it protected against. In December of 2014, the American Food and Drug Administration approved a 9-valent vaccine, and this is called Gardasil 9. This includes type 6, 11, 16, 18, 31, 33, 45, 52, and 58. So the addition of these 5 additional strains gave us coverage for an additional 20% of HPV-related cancers not covered by the original Gardasil vaccine. So efficacy of the vaccine. The vaccine protects, and again, I really honed in on the GYN realm of things. Cervical cancer and precancerous lesions were reduced by 98%, vulvar and vaginal precancerous lesions protecting 100%, and genital warts 99%. So who should get vaccinated? Again, the Center for Disease Control is really pushing that we look at this vaccine as a cancer-preventing vaccine, not just a sexually transmitted disease-preventing vaccine. Recommendations for women and men. Vaccination of females is recommended with either the 2-valent, the Cervarix, the Gardasil 4, as long as the formulation still remains available. And so that's if offices still have this vaccine and have yet to switch over to the 9-valent, or the 9-valent HPV. Routine vaccination at age 11 or 12, but can be done as young as 9 years old. And vaccination is recommended through age 26 for females. So those females that did not get their vaccine with their pediatricians, these are the ones that we're going to pick up in the GYN office, hopefully before their 27th birthday. Yes?
So if somebody had the 4 and now there's a new one for 9, can you get that?
They're not revaccinating right now with the 9. Now let's say that someone started the 4 vaccine but has not completed it. Let's say they got, and we'll go into the dosing or the administration of, let's say someone got their first dose of the Gardasil 4 and they're due for their second dose. We would switch them over to the Gardasil 9 at that point. Recommendations for men, and this is a newer one. So vaccination of males is recommended with the 4-valent HPV or the 9-valent HPV. So the Gardasil 4 or the Gardasil 9. All boys at age 11 or 12 or as young as 9 years. Older boys through age 21 if they did not get vaccinated when they were younger. And then the 2 other caveats that they give for men: gay, bisexual, or other men who have sex with men through age 26 if they did not get vaccinated when they were younger, and men with HIV or weakened immune systems through age 26 if they did not get vaccinated when they were younger. So the vaccine schedule is dependent on the age of recipient, and this has changed a little in the last couple years. Historically, the vaccine was a 3-dose schedule. This has changed a little. If given before the age of 15, we actually use a 2-dose schedule. So they get a dose at 0 months, and then they get a dose at 6 months. Now, the only caveat to that is if the interval between doses is shorter than 5 months, they then do require a 3rd dose, given at least 6 months after the first dose. Now, if they're greater than 15 years old or 15 or older, they get a 3-dose schedule. So they get one at 0 months, 1 to 2 months, and 6 months to complete the series. Now, let's say you have someone who got their first dose, and then they came in 2 months later and got their second dose. Well, then they went to college, and they just forgot on spring break to come back and get their 6-month vaccine. They can get this at any time. They do not have to resume or start from the beginning. They would just get their 3rd dose whenever they present back to the office. Common side effects associated with the HPV vaccine: syncope or fainting, dizziness, nausea, headache, fever, and injection site reactions, which are primarily pain, swelling, and redness. So let's debunk the HPV myths then with what we've learned today. So only women can get HPV. The truth of this is HPV is common among both men and women. About 80% of people will get an HPV infection at some point in their lives. In most cases, HPV goes away on its own. When it remains, it can lead to health problems such as genital warts and several types of cancer. This includes cervical cancer, anal cancer, penile cancer, and oropharyngeal cancer, Again, tonsils in the base of the tongue. People with HPV show symptoms. Truth, most people with HPV don't know they're infected and never develop symptoms or health problems from it. In 90% of cases, your immune system fights off the infection within 2 years. You must have sexual intercourse to get HPV. Truth, HPV is spread by intimate skin-to-skin contact. While most cases are sexually transmitted, people who haven't had intercourse can become infected. Using condoms helps, but they don't completely protect you against the virus. They don't cover all the genital skin. There are treatments for HPV. There aren't treatments for the virus, but there are ways to treat HPV-related health problems, such as precancerous lesions and genital warts. HPV interferes with pregnancy. This is something I didn't touch on too much in the lecture. In the majority of cases, HPV does not impact a woman's ability to become pregnant. If you're pregnant and have HPV, you can get genital warts or abnormal cells changes on your cervix. Regular screening can find these and your doctor can treat them. Becoming pregnant after receiving the HPV vaccine is safe. The vaccine doesn't affect a fetus. The HPV vaccine protects you for life. The vaccine is effective for at least 10 years, and that's what the studies have showed us. But doctors are optimistic that it will provide more long-lasting protection. If further studies show the vaccine is losing its effectiveness, a booster vaccine may be required. HPV vaccines are all the same. There are a few key differences in the 3 HPV vaccines approved by the FDA. The Cervarix and Gardasil protect against the most common HPV types and against cervical, anal, vulvar, vaginal, penile, and oropharyngeal cancers. Only Gardasil protects against the HPV types most likely to cause genital warts. These vaccines prevent about 70% of cervical cancers. The latest vaccine, Gardasil 9, protects against 9 types of the HPV virus, including 5 that the other vaccines don't cover. It also will prevent about 90% of cervical cancers. Your doctor will determine the most appropriate vaccine for you or for your child. The HPV vaccine increases sexual activity, and this is a very common myth that we hear in the office. No research links the HPV vaccine to increase in sexual activity. Boys and girls who get the vaccine don't have sex earlier than those who haven't received the vaccine. Also, they don't have more partners than those, or don't have more partners after they do become sexually active. Myth 9, the HPV vaccine may cause dangerous medical problems. The HPV vaccine is a safe drug and doesn't contribute to any serious health issues. Like any vaccine or medicine, the vaccine may cause mild reactions. The most common are pain or redness in the arm where the injection was given. You got the HPV vaccine so you can skip your pap test. Truth, absolutely not. Because no vaccine prevents all types of HPV that cause cervical cancer and other HPV-related cancers, vaccinated women aged 21 to 29 should still receive pap tests every 3 years. In addition to pap tests, women aged 30 to 64 also should be tested for the HPV virus every 5 years. This exam checks your cervix for the virus that can cause abnormal cells that lead to cervical cancer. It may show that more frequent screening is needed. Women aged 65 or older should discuss their individual need for screening with their doctor. So, some take-home points from today. HPV is a very common virus, passed from one person to another during vaginal, oral, and anal sex. Most people get HPV, but usually it goes away on its own. Most people, or most women with HPV do not get cancer. If HPV doesn't go away, it can cause precancers that can be treated, or cancers if the precancers are not caught in time or failure to seek care. To lower your chance of getting HPV, use latex condoms the right way every time you have sex. but be aware that condoms may not protect fully against the HPV virus. Be in a mutually monogamous relationship. Have sex only with someone who is only having sex with you. And then some take-home points on the vaccine. The vaccine can prevent HPV infection, which is not completely prevented by condoms. While the HPV vaccine offers protection against cervical cancer, about 19% of cervical cancers are not covered by the new 9-valent vaccine. Therefore, it is important to continue getting screened for cervical cancer, even if you have had the vaccine. The HPV vaccine is safe. It does not cause HPV. Few serious side effects have been reported with the HPV vaccine. Most are minor: injection site pain, low-grade fever, nausea, dizziness, or fainting. None of the HPV vaccines contain thimerosal or mercury derivative or any other preservative. And there is no evidence that HPV vaccines encourage sexual activity. Do we have any questions?
Are there any implications for the baby?
So there are rare case reports of babies being exposed to the virus in utero or during delivery, and they can develop papillomas in the throat. The incidence of it is pretty rare, and so without large lesions, we typically will allow people to have normal vaginal deliveries. Yes?
Is it the pediatrician that's recommending all girls and boys get the vaccine?
Yeah, so our goal is that these young boys and young girls are picked up by their pediatricians and given this at the age of 11 or 12. The goal with the vaccine is that they get the vaccine before they become sexually active. Now, it doesn't mean if they have become sexually active and have not gotten it that we would not give it to them, but the goal is to get these kids before they become sexually active and are exposed to the virus. But yes, the majority of these are going to be captured in the pediatrician's office. From my office's standpoint, we're going to try to capture those that declined it at the time, or maybe are young adults now. They didn't get it when they were young and now are interested in getting it. So women in their early 20s.
So women are coming to you for pap smears, hopefully in their 20s. What men in their 20s are going to their doctor and for what?
So that's what's tough, and there's no great screening tool for men. I focused briefly on the types of cancers associated with HPV and men. The tough part is we don't have a great screening tool for them. So it's primarily picked up when they have symptoms. So my hope is certainly with all the research and stuff going into this, that part of this is going into a screening tool that can be utilized for men.
I remember hearing, to me it was sounding kind of crazy, but an objection to the vaccination on some wild. Make a sales pitch for vaccination overall.
So overall, my take with the HPV vaccine is that this is a cancer-preventing vaccine. The research has showed us that this is safe. Yes, can be associated with minor side effects, but the literature and the data really show us that this is going to prevent a large majority of not only cancers for females, but also cancers for males. There's my pitch.
A question regarding the low-risk treatment options. You said it's a long time. What's a long time?
About 16 weeks is typically. So it really requires a lot of diligence, and they have to do it regularly, typically 3 times a week, and it's associated with some discomfort. So we sometimes, compliance can be an issue with that type of treatment. So we try to go through that doing it at home doesn't mean that it's any easier than having it done either in the office or having a surgical procedure done.
Any other questions?
Okay, well, thank you. Have a good day.
Thank